before we talk about the cervical spine, let's do a little spine 101. Okay, the spine, there are about, I don't know actually how many different regions of the spine are there?
So we have the cervical spine, thoracic spine, lumbar spine, and the sacrum. So it's divided up into 4 distinct regions, but generally what happens is it sort of melds into one. So you can have specific cervical spine problems, but issues that happen in the cervical spine can also transition into the upper thoracic spine, and then issues in the lumbar spine can transition into the lower thoracic spine. So there really is sort of a smooth transition despite the fact that there are a few distinct regions.
Now we're looking at this particular graphic of the spine. So what are we looking at to our viewers at home? Tell us a little bit about this.
So what we have in the front is, so you can see the blue bulges, okay? So those are discs, and essentially those are your shock absorbers that you have between your vertebral bodies, which are the white blocks that you see.
Okay.
I believe, that's probably an arterial supply. That doesn't really look like a nerve. So I think the red is actually meant to depict segmental arteries, but I think it says nerve there. So essentially nerves coming off the spinal canal will actually exit from the spinal canal itself and exit below each of the pedicles, or above, depending on the relation and whether or not you're in the cervical or lumbar spine. So each of these nerves that come out can be compressed by either bones, so that could be hypertrophy in the vertebral body, something called an osteophyte, or bulging in the discs.
But I see numbers like C1, C2, C7.
Correct.
What does that stand for?
So C is cervical, 7 is the 7th cervical vertebrae, for example. So C1 would be your first cervical vertebrae, which would be up tier 2, 3, 4, 5, 6, 7, etc. So it's just our way of numbering it so we can decide, okay, well, this is where your problem is for any sort of operative treatment.